Long time. Oh, thank you so much for coming. Hi, we know Brad Hessian.
Insurance
178.
and insurance.
Flight insurance.
Difference today. Hindi man niya kailangan hindi mga kumakaibig mo.
So flight cancellation.
Your computer.
Good evening, everyone. We are going to begin promptly at 7 p.m., which is about 1 minute from now. Also, we'd like to kindly ask if everyone could mute themselves as well. We have some background noise. Okay, well, it is 7 o'clock here in the East. I want to say good evening to everyone and welcome to the 5th installment of our DEP Medical Webinar Series. I'm David Brown. I am the founder and CEO of DEP Medical. Excuse me. Tonight's topic, post-procedure pigmentation management with the DEP platform. Our speaker this evening is Greg Chernoff, MD. Dr. Chernoff hails from Indianapolis, but also has offices in Santa Rosa, California, and Palm Springs. Without further ado, ladies and gentlemen, Dr. Chernoff.
Good evening, everyone, and welcome to this evening's webinar. We'll be doing these monthly. We'll be adding new and interesting cases as we go along. At the end, we'll open the webinar up to questions. Because within the scope of things that we're doing with DEP, we're utilizing many regenerative and cellular medicine therapies. It's very important that everyone be familiar with the June 3rd, 21 positioning of the FDA on biologics, on cellular medicine products, and certainly adhere to these. And this is really why the DEP has become so popular, because currently, from a FDA standpoint, utilizing biologics such as exosomes really can only be utilized topically. And so we've spent, since the FDA positioning, we have really spent an inordinate amount of time over the past 4 years perfecting topical absorption, and the DEP has really been central to this. All of the patients that we're presenting tonight have been treated either in our Indianapolis or our Santa Rosa, California practices. The whole field of regenerative medicine has really grown exponentially. It's really very much now an interdisciplinary field, and we're really focusing on the regeneration, the replacement, or the repair of tissues. And what's important, though, is that we restore normal function. So products can be regenerative if they restore normal function. A product can be biostimulatory if it stimulates various cells, but if normal function is not restored, then it's truly not bioregenerative. We've shown in the literature, these are the components of the extracellular matrix that we're able to regenerate. Certainly fibroblasts, collagen, both types 1 and 3. We've seen beautiful new elastin production, proteoglycans, and in our wound healing patients that I'll share with you, we'll see beautiful examples of angiogenesis. Another area that we're utilizing the DEP extensively is in this whole concept of skin priming, and it really follows the analogy if we are planting seeds in the garden, such as exosomes, such as peptides, that we want to maximize the quality of the soil. So this is the list of various things that we have shown have benefit and efficacy in the whole field of skin priming. We also want to ensure that we have a healthy patient. So any patient that we treat prior to, we do a full hematologic male and female panel for them. We've identified many metabolic deficiencies in patients which would have led to really outcomes that were not optimal. And so ensuring your patient's health really cannot be overstated. We'll also be highlighting the benefits of nitric oxide therapy. Nitric oxide is also a gaseous molecule in our bodies that is responsible for and involved in the majority of enzymatic reactions in the body. So the whole field of regenerative therapies, again, leading up to much of the research that we've done with DEP. Again, my practice is limited solely to aesthetic, plastic, and reconstructive surgery, but for over 30 years, we've been involved in the very exciting field of research of cellular medicine, regenerative, and stem cell therapies. And this began for us in the late 80s, early 90s, where we found that we could take post-auricular biopsies of our patients, send these to our lab in New York. We found that we could tissue culture fibroblasts, cell expand them, cryopreserve them, and then reconstitute them to ship them to doctors for injection. And this led to our first cellular medicine paper utilizing autologous cultured fibroblasts. And this was really a tremendous advancement. All that we had available for injection at this time was injectable collagen. And we really weren't able to achieve many of the results that we're able to achieve now. Autologous therapy, and we went on to get injectable fibroblasts FDA approved. Because autologous was very important, we then came to find that a patient's own autologous fat-derived stem cells. During the original Cold War, the Russians were afraid of a nuclear attack, and so at that time they sent their scientists out to find what they would hope would be a cure for radiation poisoning, and that's when they found that our fat cells were a very rich source of our stem cells, the same way that our bone marrow is. But our bone marrow only has about 80,000 stem cells per ml. Our fat has over 1.5 million. Our bone marrow stem cells decrease in number and efficacy over time. For some reason, our fat stem cells do not. A bone marrow biopsy hurts, whereas me harvesting 100 cc's of a patient's fat under a local anesthetic is a pretty innocuous procedure. Roche then makes the enzyme that we mix the fat with that separates your fat cells from the rest of the soup that makes up your fat. That's called stromal vascular fraction. And it's the stromal vascular fraction that's very rich in your own stem cells. This led to our second publication looking at autologous mesenchymal stem cell derived stem cells for the utilization both for functional orders, but then we also looked at various issues facing the aesthetic plastic surgery realm. This is also where I had the pleasure of meeting Dr. Nathan Bryan. He's one of the world's most foremost authorities on nitric oxide. This is his new book. I really recommend that you get this for your library. There's really tremendous information in this and will help you understand the whole concept of cellular and regenerative therapies. We came to see in our autologous derived fat that it wasn't the actual stem cells that were doing the work. It was the paracrine effect of the exosomes that they were secreting. And we also came to find that optimizing our patients' metabolism, both with a oral nitric oxide supplement as well as a topical nitric oxide serum, which is really a two-phase product. One side is sodium nitrite, the other side is vitamin C. When you mix the two together, you get the gas nitric oxide. So this acts as an excellent tissue primer. We utilize this before any products or anything that we are trying to propel into the dermis, and it really just acts as a vehicle of enhanced absorption. So these are Nathan's other two books that I really recommend that you keep in your library because they really go over the science and the strategies involved with nitric oxide. And we've published several papers looking at utilizing topical nitric oxide, oral nitric oxide with exosomes, utilizing the DEP to propel these beautiful particles into the tissue. Also for treating acne, as we'll show you, combining the DEP with any macromolecule that you're wanting to propel into the tissue has really tremendous benefit. We were not, and to this day, we have not been able to get autologous fat-derived stem cell therapy FDA approved. Although I think we have a window, it's well known that Robert Kennedy Jr. is very pro stem cell therapy, very pro autologous therapy. So I truly believe within the next 3 years, the companies that are serious about certainly exosome therapy, because again, no current exosome company has FDA approval either. And I firmly believe within the next 3 years, those companies that are serious about their science will achieve FDA approval. So this is what led me then to look for an off-the-shelf form of cellular medicine. And this is when we started our exosome research in April of 21. We published the first paper looking at human placental mesenchymal stem cell derived exosomes for aging skin. This was really a double-blinded saline placebo control study. And uniformly, we found that in the exosome patient population, that the exosome patients consistently showed an improvement in the tone, quality, clarity of their skin with a consistent reduction in wrinkles, reduction in pore size, an improvement in the tone, the quality, the clarity of their skin. We also then came to see, though, that there are many other injectable products that are known bioregenerative products. We are a member of a multi-centered study looking at the role of hyperdilute calcium hydroxylapatite, or Radius, as a bioregenerative product. Sculptra is another example of a bioregenerative product. And we found that we could certainly, again, regenerate collagen types 1 and 3, elastin, proteoglycans, and that the effects were long-lasting and significant. But utilizing the DEP and utilizing topical exosomes with tissue priming in mind, we demonstrated in this Journal of Cosmetic Dermatology paper that if we pre-treat any area that we're doing an injectable bioregenerative product, such as injectable Radius, that patients got a better result quicker. And utilizing the DEP again keeps this a needle-free application for your patients. No patient likes needles, and especially in areas such as hyperhidrosis, when we're injecting palms, when we're injecting the axilla, when we're injecting the soles of the feet and having to inject them hundreds of times. It was tremendous benefit when we found the propulsion utilizing dermatoelectroporation with this. So we were able to show that by, again, topically priming the tissue with exosomes, that our injectables got a better result. So this DEP technology, what exactly is it? How is it that it's been transformative? This really utilizes electrical current to propel macromolecules up to 800 Daltons into water-based and electron-based channels into our tissues. I'll show you in a video this has an impedance feedback mechanism with these sliding LED lights, such that when you put whatever you're wanting to propel into the tissue and you utilize the electrical transducer, you'll see that as you begin, that the impedance monitor is going all the way over to the right, and this is your guide to successful therapy. Because as you continue to utilize the DEP in a specific area, you'll see that the lights do not go over as far to the right, and eventually they'll reach an endpoint where they stay static, and that's your signal then to move on to another area. You can select the current on whatever area you're looking at. And this is what patient tolerance is really based upon the thickness. Remember, the thickness of the tissue varies from the forehead to the eyelids to the temple areas, from the cheeks, in the perioral area on the neck. Where the skin is thicker, the patients will tolerate a higher current. Over areas of bone, again, they're not as tolerant. But again, employing the gate theory of pain, this vibration mode in the systems really works beautifully. So that's what patients feel, the vibration mode as they are being treated, and you can set the strength of that as well. So DEP has coined this term predictive permeation, whereby, again, we now have maximized the absorption of topical products, and we're working on some studies for DEP in a dose response standpoint, such that we'll be able to let users know and patients know that based upon their thickness of the skin and how deep do we want to go, here's the current necessary to achieve that. So this is really an advanced technology. As I mentioned, what do patients like about it? That it's needle-free. So it's, in essence, totally painless for the patients. What patient wouldn't like that? Many patients are needle phobic. So we're doing everything to maximize patient comfort with this, to maximize the efficacy of our absorption. So again, we are with the electrical current, we create these microchannels in the dermis that actively allows us to predictively gauge how deep we're going with the various products. So again, as I mentioned, you have immediate feedback looking at the impedance monitor. So this allows us then to deliver very consistent and effective products into the tissue for reproducible results. We're overcoming patients' fears of needles. There is really no downtime with patients. They come in for a treatment and go about their activities. And again, when you take needle delivery into effect, again, pain is different, pain tolerance is different. And so depth of penetration, unless you're utilizing a computerized injection system, your depth of penetration with needles is very uneven and not predictable. So DEP really addresses these very important issues of patient comfort, consistency of treatment, which then leads to ultimate reproducibility of your efficacy. So it's really these three major points that really set the DEP apart and allow you then to understand what does predictive permeation mean. So when we're doing these treatments, again, remember the stratum corneum is called a barrier for a reason. So we first cleanse the skin. We utilize salt crystals to exfoliate a patient's tissue as opposed to aluminum hydroxide crystals. In this instance, we're utilizing needle radiofrequency for acne. The most common soup that we utilize for treating aging skin is a combination of 1 ml of a low G prime hyaluronic acid, 1 ml of exosomes, and 25 units in 1 cc of botulinum. If we're treating face, neck, décolleté, arms, legs, we'll utilize PRP or PRFM as a scaffold effect to enhance the results. We then put on the nitric oxide and continue on with the treatment. So again, showing again with the DEP. So again, we're mixing up our aging skin soup, and that's the other thing that DEP will have is various formulations for various conditions. We're placing on the nitric oxide serum to enhance the absorption of what we're wanting to place on. And then we're going to, again, propel this into the tissue. We're now adding our combination of exosomes, hyaluronic acid, and botulinum. Botulinum into the epidermis and dermis relaxes the smooth muscle in the sweat glands, and again, decreases static wrinkles. So here we're utilizing the dermatoelectroporation. You can see the LED lights going over to the right and then progressively decreasing as you fill up the glass in that area, so to speak. And then we'll move on to another area. So again, lights go to the right, the glass is still empty. Lights go further to the left and stop eventually. That's when you know that you've completed the treatment in that area. So here we're using a moderate amount of current. Her skin was a little thicker, and she's got a good pain tolerance. So our vibration was really on a low. And you'll really gauge this, and that's the beauty, is you can customize your patient's treatments, not only on what you're placing to the patient, you can gauge the depth of penetration by the current that you're utilizing, and you can monitor patient comfort, which reflects the gate theory of pain by the vibratory mode that we utilize with this. So some examples again, beautiful. This is 1 month after a single application. So you can see again, and she's a Fitzpatrick type 3 with significant acne. She's very prone to PIH or post-inflammatory hyperpigmentation. So in her, we used a combination again of hyaluronic acid, exosomes, botulinum, but then we also put in some tranexamic acid to deal with the PIH or the post-inflammatory hyperpigmentation, and a beautiful result after a single treatment. And for her, also the added benefit was that this was totally painless. So again, just saying repetitively, but that's good from a learning standpoint. This really allows you multimodal and multimodality recipes to utilize for your patients. So you can deliver based upon every patient is different. Every patient is coming to you for a different reason. And so DEP, again, will have various pre-made combinations of soups, if you will, for problems such as aging skin, eczema, rosacea, hyperpigmentation, hyperhidrosis, and for scar therapy as well, by utilizing the various combinations of ingredients that we are showing you here. So again, this has really maximized our delivery capabilities. Gone are the days that two-dimensional photography is really acceptable for showing results. We utilize the Quantificare manner of photography, which is a 3D photograph and the Quantificare system and their software measures wrinkles, pores, evenness, oiliness, pigmentation, and vascularity. Quantificare has now almost a 30,000 patient database. So every picture I show you will have a graph ranging from +10 to -10, where a +10 represents the top 2.5th percentile of Quantificare's best patients, and a -10 represents the lowest 2.5th percentile of Quantificare's worst subjects in that area. And when you enter your patients, the software is race-related, age-related, and sex-related. So your patients can compare themselves to other patients in their age group, their sex, and their race as well. So this is one of our patients that was in our DEP skin study prior to, and so watch all of her graphs. So the patient then went in our skin study through 3 treatments monthly, and at 90 days, again, all of her graphs improved. Look at how her wrinkles get better. To the right, her pores get better. Her evenness of her skin improves, and her oiliness decreases. Her pigmentation improves, as does her vascularity, her hypervascularity, and her telangiectasias. By dermal ultrasound, green signifies neocollagenesis. So at 30, 60, and 90 days, we see a beautiful new Grant zone of neocollagen. And in all of our histologies, again, we saw beautiful neocollagenesis, beautiful neoelastogenesis. So what are the ways that you can implement DEP into your practices? Aging skin is certainly the easiest. So as I mentioned, we exfoliate the stratum corneum, apply nitric oxide, utilize our combination of exosomes, hyaluronic acid, and 25 units of botulinum. Again, topical botulinum placed into the epidermis and dermis relaxes the smooth muscle and the sweat glands, and consequently then reduces fine static lines. Many papers on looking at the benefit of LED light therapy. And so we also then utilize LED light therapy after these treatments, again, to fertilize then. So we've planted the seeds into an optimized soil, and now we want to fertilize those seeds. And there's no better, another painless way is to do that with LED light therapy, but it is also wavelength specific. So if we're dealing with acne, remember the inflammatory phase of acne precedes the pustule or the comedone phase. So anything you can do to reduce inflammation in your patients goes a long way to helping them with their acne. So red-blue light for acne and inflammation works the best. If we're looking at skin rejuvenation and collagen regeneration, combinations of red or red light and either yellow or near infrared works the best. And you can do traditional PDT or photodynamic therapy utilizing a blue wavelength light. So what do these patients look like? And all of these patients now, again, are 1 month after a single application utilizing the skin rejuvenation DEP soup that we talked about. And you can see her tone, quality, clarity is improved, and all of her graphs improve. Again, 1 month after a single biostimulatory facial utilizing the DEP, her wrinkles improve. Look at her graphs. Her pores improve. Her evenness improves. And the patient just looks better. And so again, you're giving a patient results and you're not hurting them to do this. So when that happens, they tell their family and friends. Their family and friends come in, and then they tell family and friends. So this has really been an excellent addition to our armamentarium, again, to improve patient results and to do it in a painless manner. So again, these patients, you can see that her tone and quality improves. We add some tranexamic acid, some kojic acid into the soup, and again, the pigmentation resolves as well. 3D on Quantificare, again, you can see look at even some of her horizontal brow lines are improving. So we're getting some of the effect of botulinum creeping into the muscular effect as well. So these are ancillary findings in our DEP study that are really showing just again the broad application of this and the benefits to the patient. Look at how her pigmentation is improved in an area of her forehead, how some of her hypervascularity has improved as well. So they just look better. Again, again, this is 3 months after 3 applications. And again, look at his pigment has improved, his tone quality is improved. Look at the texture of his skin is better as well. Unfortunately, he's a sun worshiper. So again, if you don't change your patient's bad habits, again, you can send the DEP home with them and they won't see results. We also educate them on what they need to be doing as well. From a post-procedure standpoint, again, we utilize the DEP on open sores such as total exfoliation, like this CO2 patient, whereby, again, we're propelling exosomes topically into the open wound. This is, again, a novel application for this, and it's stimulating reepithelialization much quicker. So never in the past would I have seen reepithelialization as quickly as day 3. And here she is then, upon reepithelialization at a month with very little erythema left. So we go on and treat her after she reepithelializes with anti-inflammatory agents, and look at again how, again, the beautiful results. Her skin looks better, her complexion looks better, her pigmentation is evened out beautifully. So with this gentleman, we're treating his malar festoons, we're treating the puffiness in his eyes, and here he is again, day 3 up to day 6, totally reepithelialized, much quicker, and these were deep. And so again, look at his malar festoons, the tissue under his skin, how he's tightened up, and he's tightened up much faster than he would have. And then here he is, in this instance, again, at a month with really And this was quite a deep exfoliation. So his festoons look better, his skin looks better, and needless to say, he's certainly very happy with those results. Another easy way for you to implement this into your practices is treating acne. Acne, is, as well as aging skin, is a multi-billion-dollar industry in our country. And as I mentioned, the inflammatory phase of acne precedes the pustule and comedone phase. So anything you can do to reduce acne and reduce inflammation in these patients, again, utilizing topical exosomes. So many chronic acne patients are depressed, as was this gentleman. So, and he had numerous kicks at the can at this. It's one of the frustrating parts for patients, is the reality fact for all of us that are involved in this, is that all of us are really victims of our own training. So any of these patients can see 10 different doctors and have 10 different solutions put forth to them. Doesn't mean anyone's right or anyone's wrong. Some succeed, some don't. So anything you can do to show a patient that they're going to get a nice result, and especially if you're doing it without hurting them, really builds trust with the patient. So for us to take them from there to there in 30 days is really quite miraculous. As with this patient, from there to there in 30 days, another cystic acne patient from there to there in 30 days. And so again, utilizing the DEP topically with our various soups, you can see her inflammation goes down, her pustule count goes down, her comedone effect goes down. Looking at the reds, her inflammation goes down dramatically from before. There she is before, there she is after. So again, goes down dramatically, and just the overall tone, the quality of her skin improves dramatically as well. And the Quantificare system is really excellent then at showing patients very dramatically the results. So when you can get an acne patient such that she's not having to wear makeup, again, you're building a lot of trust with that patient. A spin-off then, again, another immunomodulatory effect and benefit utilizing DEP is for rosacea patients. So to go and to get this patient again who's been on numerous different treatments, but again, when we can propel products that work in a consistent, predictive manner to get the results, again, we have very happy patients. And another same scenario with this rosacea patient. And again, look at her pores, how we've reduced her wrinkles, we've reduced her pores, we've reduced her redness, we've improved her pigmentation, and all of her graphs improve. So thinning hair in 2025 has replaced aging skin in women as it relates to the #1 feature that has a negative effect on their self-esteem, and as is alopecia for men. So you can also utilize DEP to propel various things that we're utilizing, such as PRP, exosomes, and various other peptides that we are utilizing for hair. This is a split scalp study, saline placebo control versus exosomes. You can see more hair growing in thicker. And remember, all of these things, they don't magically grow new hair. Traction alopecia, we see beautiful improvement in our traction alopecia patients. These things that you're applying topically improve the blood supply of the scalp, increase the number of hairs in the growth phase compared to the resting phase, and increase the size of the dermal papilla cells in the follicle. So it makes whatever a patient has look thicker. And so time and time again, men and women, you'll simply, again, make whatever they have look thicker. And we can now measure this with various hair systems that give us a hair count, measure the diameter of the follicle. And so again, much more credibility other than just showing a two-dimensional photograph, trying to talk you and your patients into the fact that they might look a little bit better. So with procedural outcomes, again, we had already mentioned the bioregenerative injectables, of which, again, Radius, Sculptra, Fat, PRP, and exosomes would be atop the list. We showed again how injectable Radius, hyperdilute, remember, dilute Radius is 1:1. Dilution with saline, hyperdilute injection is a 1:2 or 1:3. After a 1:2 dilution, Radius loses near all of its G prime effect. So if you're needing any volumization or lifting, then you're going to be using it full strength because there's no lifting capabilities once you hyperdilute it. And then we showed that by pre-treating, utilizing DEP with exosomes, you get a better result quicker. So here we're utilizing a cannula method of injecting hyperdilute radius into the neck to help soften necklace lines. But we've pre-treated this area with DEP, with our aging skin recipe. And here she is again 30 days afterwards. And you can see her skin just looks better. Her necklace lines are softer after a single application with this. So we continue on a monthly routine. And again, you'll see progressive improvement. So here we've utilized a combination, again, of, in this instance, full strength radius and hyperdilute radius with pre-treating with DEP and exosomes. And again, look at just the lines around her mouth in the nasolabial folds are softer. Her pigmentation is improved because we added some tranexamic acid, some kojic acid. So she just looks better. Look at how she's lightened a shade or two. So again, we're seeing results without needles that we just never saw before. And so again, with my fat transfer and pre-treating, again with exosomes, look how we volumized her in the malar area. We volumized her lips, but look at the skin around her mouth, how it's just improved. So we get the volumization that we can measure with quantificare, the volumization of her lips. But again, just the quality of her skin just looks better from a pre-treatment standpoint. So again, you can see how we've improved the quality, we've reduced some of her pigmentation, and she just looks healthier, but she doesn't look done. And that's really paramount when you're entering into this. Give natural results, provide natural results, don't make them look done. Treating body areas. There's a body handpiece, and I'm, start with what you feel comfortable with. DEP has different offerings, combinations of facial hair and body. I'm of the belief that if you're going to get in the game, then you should have all the tools that you need, because you'll get great results with the same recipes that I've shown you in treating the décolleté and treating hands. From a pigment control standpoint, again, utilizing combinations of tranexamic acid. Remember, the DEP is colorblind, so you can treat types 1 through 6 skin with this beautifully. And here she is, again, in this instance, we're a couple of months after 2 treatments with really beautiful results. The same with this patient. She doesn't look happy here. She's very self-conscious. And so we're seeing progressive lightening. In this instance, we're after 3 months of treatments. And the same with this patient. Even after a single treatment, she's starting to look better. She's having to wear less concealer, as with this patient. All of these patients very prone to PIH or post-inflammatory hyperpigmentation. So we start pre-treating them in that manner before doing anything else with our pigmentary soups. And again, this is how we start to see some nice evening. And again, this is some really exciting work again that we're doing, showing how again we're stimulating, we call it melanocytic creep, and we're helping hypopigmented areas to look better in our scar population, in our wound healing population. So again, this is after 3 treatments spaced 30 days apart. But she's so much happier. She's not having to wear as much foundation to cover things. And we're continuing treatment. So look at how the tone and quality is improving, but so is the coloration, the blending of her skin. After injectable fillers, again, here you can see our volumization of the temples, of the midface, of the lower third, and the quality of the skin looks better as well. And the same really with this patient. Post-volumization, an improvement in the quality of skin. She just looks better. She looks healthier. We're seeing more people inject fillers, and so as a result, we're seeing more vascular events. So the combination of topical exosomes in conjunction with topical nitric oxide delivered with the DEP should be in your toolbox in your armamentarium for treating vascular occlusions. So this was an attempt sent to me by someone that attempted injecting the nasolabial area, got into the infraorbital distribution. She's already in a lot of pain. So again, we apply topically. There's a very high antiprostaglandin effect with exosomes as well. So applying this with the DEP, we're utilizing the DEP so it doesn't hurt her, because again, we add a little topical anesthetic in with this treatment. And she goes from there to there in 4 weeks, which would have been a total disaster otherwise. And we're seeing the axolotl salamander scarless wound healing model, because again, this with the exosomes, because again, this was necrotic. As with this gentleman had sadly 3 mLs of Juvederm injected into his nose to try to soften an S-shaped deformity. This was a vascular choking, not just an occlusion. So utilizing our combination takes them from there to there within a very short time. For hyperhidrosis, again, nobody likes lots of needles. Mark Nestor did a great poster presentation showing the benefits of DEP for the treatment of hyperhidrosis. So that's also a very novel way to utilize it. Many practices now are buying up the non-surgical fat reduction systems, and across the country I'm seeing really almost an epidemic of Ozempic faces, Ozempic bodies, and Ozempic bums. And so again, we're really, and all these patients then have a skin envelope that is losing elasticity. So the same recipes that I've shown you, utilizing the body DEP, helps to resolve many of that. In my fat transfer patients, in my Brazilian buttock lift patients, by pre-treating the skin with exosomes, and again, in using some of the pigmentary recipes that we use, we're getting a better take of our fat, a nice blending of the skin envelope as well. And in our cellulite patients, again, we're seeing beautiful results in cellulite, and with the quantificator, you can show the volumetric improvements with these. In our surgical rejuvenation patients, again, anyone who's a type 3 to a type 6 after surgery, they're prone to more PIH. So we pre-treat with the DEP and with our various recipes, and in the post-op period treat. And that's how we can brighten her skin. Remember the 3 reasons that people come to see us only. Number 1 is the gravitational descent of tissues. Number 2 is volume loss. Number 3 is the loss of tone, quality, the clarity of skin also. The number 1 side effect of hormonal changes in women is pigment variation of the skin. So we're dealing with all of that at the same time. So I've done, again, a deep plane face neck lift for her, but we're dealing with her melasma, and we've revolumized her as well. So she looks like she could be her own daughter. And by treating her scars with exosomes, again, you have to look really hard to even see her preauricular postragal incisions, and this is at 1 month. As with this gentleman, again, he just looks healthier. So we've dealt with his gravitational changes, but we've also dealt with his volume loss, and we've dealt with the quality of his skin. So we're not just looking at one, we're not just looking at the sleeve of the shirt, we're looking at the whole shirt. And he just looks better, he looks healthier. And again, even at a month, you have to look hard, starting to look hard to even see his preauricular postragal scars. Another example, deal with all of the features that the patient is presenting with. Deal with the whole picture of the patient, and they'll be much happier and much happier quicker. And even at a month, look how you have to look hard. Her hair is blocking it, but you have to look hard to see her scars. In our scar therapy, we're utilizing the DEP again to help propagate our scar healing combinations into hypertrophic scars, and we're seeing nice results in our scar therapy, both from a topography standpoint and a coloration standpoint. In our keloid patient populations, again, we're excising keloids with the carbon dioxide laser, applying amniotic grafts if we have to, utilizing exosomes here. So here we've excised the keloid with the CO2 laser. We know that if you cut it off with a scalpel, it comes back 100% of the time. The heat effect of the CO2 laser downregulates the fibroblasts, so it decreases the patient's propensity to redevelop the keloid. We apply an amniotic membrane graft, flood it with exosomes, use the DEP Look at beautiful example of VEGF, beautiful new vascularity growing into that graph. So here we are at a year. Here he is now at 5 years, no recurrence. My position in heaven is secured, by the way. This is my African-American priest who is part of our study. And so he, needless to say, is very happy with this. We'll finish off with male and female sexual health. Again, we pre-treat the labias with our exosome combinations prior to labiaplasty, prior to G and O spot injections. We're utilizing our topicals in conjunction with nitric oxide. With healthcare being what it is, I'm seeing many more 70 and 80-year-old patients. They want to have sex too. Many of these female patients, though, have dryness, have painful intercourse. So we've learned that fractionated CO2 therapy intravaginal followed by topical exosomes works beautifully to restore glandular function intravaginally. And many of these patients also have perennial laxity, so they have urinary incontinence, sometimes fecal incontinence. So topical radiofrequency followed up by topical exosomes utilizing the DEP to maximize absorption has really been performing like anterior-posterior repairs in many of these patients. An example of the immunomodulatory effects of exosomes, lichen sclerosis, is an ulcerative immunomodulatory effect affecting millions of patients in our country. This lady hadn't had sex for 5 years. Here she is 1 month after weekly treatments, life-changing for her. So the DEP allows us to impact our patients' lives and the experiences that they have in our office in really ways that are hard to put to words. They're extremely grateful. You're able to deliver consistent results with versatile treatments in a needle-free manner, which again allows the consistency and the precision that has really been missing in many ways in the past. And so again, comparing this to the tradition, to different traditional levels, there's really next to no pain with this. There's the same thing, next to no downtime with a high consistency, very extremely versatile, and you're really helping a patient from a comfort standpoint. And so this has really led us to an increased referral base. The price of this instrument is also much less than many other things that you've wasted money on in your office because they either haven't worked or their packages because of what the equipment, the initial outlay was so high that you've had to set prices much higher. Return on investment of this instrument can be achieved very quickly, and again, it also helps to set you apart. But the word is really spreading across the country as it relates to DEP. But it's really high tech. It's perceived as such by patients, so it allows you to differentiate your practice. As I mentioned, from a revenue standpoint, the ROI is really excellent. Patients come back for more treatments, and they tell others as well. And it's a very simple instrument to utilize. My nurses, my estheticians, I use it as well, but it's very easy to teach, so long as you follow the rules of looking at the impedance monitor as well. DEP really has, I give credit to David and his company. They're excellent at helping you get trained properly with excellent marketing support, and they're there, unlike many companies who, after you buy a system, you never hear from them again. They're really great at ongoing support. So I'll leave you again. This is all the information, the contact information. I'm happy to open this up for questions if people like. I would ask you to identify yourself, though, if you have any questions, and I'm happy to open it up now if you have any questions. So if you unmute yourself,
Or they can use the chat box,
yes,
Dr.
or
Chernoff.
the
The
chat
chat box is open.
All right,
Yeah.
or the chat box.
Yep. Yeah. That was a riveting presentation, Dr. Chernoff. I'm shocked there's not questions.
And if you have questions, you can also contact David, or you can contact me as well, just at greg@drchernoff.com. I'm happy to field any questions if you have any. as I said, we are doing these monthly. We always have. The system runs 6 to 8 hours a day in our office. So there's, and we're really seeing tremendous results through all skin types, and so it's extremely versatile in manners that the things like needle radiofrequency are not, because of the effects on a type 3 to 6 patient.
Well, I do not see anything in the chat box.
Okay.
So again, as our contact information is there in front of you on the screen, info@depmedical.com. My email is david@depmedical.com. You can schedule a half-hour Zoom appointment with me to learn more. But if no one has any questions, I would again like to thank Dr. Chernoff for his time and just an unbelievable presentation. I hope you all enjoyed and got something out of it. Thank you, Dr. Chernoff.
Thanks, David.
Thank you, everyone, for
Yes.
attending. We deeply appreciate that. And we